patient scoots. So the patient scoots and I help them a little bit. See how I did that? Very nice. Respecting boundaries. If the patient's shirt is riding up, I cover it so the patient's not self-conscious and starts, arching their back in weird ways to cover up whatever thing they got going on back there. And I also have this hand here. And this is mostly because I've gotten kneed before in the crotch. And no matter if you're a male or female doctor, you probably don't want to do that. So sometimes when the patients scoot forward, this knee is unpredictable. So I always have a hand here and a hand here. I would never reach underneath the knee, underneath like that, do any kind of weird thing like that. It's just, there's some boundary issues with that, and you don't want to put yourself in a situation where you could potentially make the patient uncomfortable. So you already scooted forward, but normally I put a hand here, I tap and say scoot, and then as the patient scoots, I help slide. That's the easiest way to do it. I don't think I've ever had a patient that laid on a table on their side where I didn't have to have them scoot. So it's just something, it's Pavlovian at this point, it's automatic. I do it every single time. It would be awesome if a patient could lay down and be like, hey, that's perfect. Let me just set up. But it never happens. So you want to get them as close as possible to the edge of the table without being awkwardly on the edge, like falling off, that kind of stuff. And a little bit. Sometimes the patients will do this when they scoop. See how I just did my shoulders? Now I'm off the table. You got to roll me over, I'm going to fall off the table. So you got to make sure that they're not scooting their upper body, which if I help them scoot, it usually solves that problem. So they scoot and I pull. If they do that, you can say, okay, I want you to keep your hips here, but move your upper body back. And I might even help their shoulders back a little bit. You don't want, like you're in a perfect position right now, but if your shoulder was, say there's no way. We start rolling you over and you're going to feel uncomfortable, like you're going to fall off the table because the pivot point is off the table already. So that's perfect the way you are right now. Next part is hip flexion. What is it? PIO. 90 or below. 90 degrees or less hip flexion. So like this. What's the contact going to be for PIO? PSIs. This is how I want you to do the arms. I'll pull that shoulder out just a tiny bit more. I want the lower hand on top of the upper hand like this down here. Not a hug like this. Not crossing your arms, and not with your hand here. Other instructors are going to have you do that. I like this for a bunch of different reasons. First, go ahead and try to roll off the table towards me. You can't, because I got this arm. So there's a little bit of safety there. Second, that is okay, but look what that did to my posture. Like, even though you don't have a ridiculously long torso, I still had to kind of bend forward like that to reach that point. And now I just broke my posture and I'm not going to be as stable down here. Here, I can keep my posture upright and then use my posture for other things. This contact with the arms crossed is okay, but what I see a lot is you push too much on the wrist. I don't want to do that to the patient. I don't think anybody's ever gotten hurt here on campus, but that just seems like it's a vulnerable position for the patient's wrist. And which is really, this is the most amazing thing for this position. We have a student population that's predominantly female here, and that usually equates to just putting a lot of pressure right over the breasts. And that's, you will all put too much pressure on this upper body part. So I just don't think that's good. Plus, that's still a little bit farther than here. So I still, with a really large patient, or if you're really small doc with T-Rex arms, you still might have to break your posture a little bit. So,
Oh yeah, that's what
Being dinosaur
Fight Club with.
Dinosaur Fight Club. Okay. Sorry.
Is that going to be on the test?
Yeah, it is. Just for you. Twice. So with the arms like this, you keep the patient pretty safe. It keeps them pretty sturdy. You have a nice contact here, and then you have some leverage for the thorax. I can move it. I can twist it when we get into lumbars. I can distract it as needed. Up here, yeah, it's more shoulder movement up here. So I'm going to recommend this. I want you to do this hand contact in this class. You can do whatever you want. You can try some of the other ones in other classes. From what I've seen so far on campus, this is going to get you what you need. This is going to get you exactly where you need to be. The other ones mess people up. So, that's perfect. Okay. So we got the hip flex 90 degrees or less. I feel like 90 degrees for you is probably perfect, so that's where we're gonna stay. So that's why I say 90 or less. It's not less than 90, because usually it's right about 85, 90 is the sweet spot for just about everybody right here. Contact here, just keep your upper body on there. My contact back here is on the PSIS. I put my hand there just as a placeholder. I'm not gonna do anything in this position at all, because this is a horrible position for me. So I have to roll the patient over. The last class, we had some problems. If I roll the patient over like this, watch this, and tell me what's wrong. What's the problem there?
Bad posture.
That, I can't bring my contact where I need it to be, and that's here. This is the whole reason I'm rolling the patient over. With the AS ilium, we're going to do in a little bit, I very well may get into the right position without rolling the patient over much. And if I'm there, I'm there. I don't need to roll them over. If I'm rolling the patient over, it means I got to get my contact here. If I'm moving my whole body, the contact's never going to get there. So I keep the patient nice and stable here, so you don't feel like you're going to fall off the table. But I have to roll this over and bring my hand contact to my body contact or my center. So I have to bring you here. Just like that. See where my contact is now? Right there. That's perfect. I can even roll you over just a tiny bit more. See how I do that? Let's say you roll the patient over and now you pin him here. That's still not good. See where my contact is? Where my center is? Now I need to ratchet you over a little bit more, but I don't want to lift my body up because you're going to feel like you're falling off. Instead, I just kind of ratchet. Boom. Pull the patient to me, and then I pin you back to the table. Feel nice and stable, right? Pretty rotated. And up the lower body's pretty far off the table here. If I were to step back from the table right now, you would hate me. You'd feel like falling off the table. Yeah, no, it would be horrible. So my body's keeping you on the table, and all of this is creating the tension that you need in the joint. I might even bring a little bit of tension to the upper body, but just a tiny bit so I'm not crushing your ribs. So see where I'm at now? Now I can actually create the motion I need for that PI ilium. Watch what I'm doing with my back legs, or both of my legs. How would you describe this motion? I'm extending the hip. See what I'm doing with the hip a little bit? And this is only applicable to the MET, or the PIR, is as I have the patient tuck your tail, push back, there we go. Let's pretend that was 10 seconds, go ahead and relax. As I go to the next barrier, I push and I can extend the hip a little bit. So what I'm doing is this. And that's what I need to do to fix that PI. I'm extending the hip and doing that to it. So my hand's pushing on PSI, pushing the innominate this way, as is my body. And my leg is extending the hip a little bit, which is helping that motion. If I just pushed on the PSIS, that wouldn't really cut it. It might get there, but if I extend the hip a little bit, that's going to get the motion that I need in the joint. So that's kind of a fancy little bit of detail that I want you to try now. Having the patient